Good evening. It's a pleasure to moderate this esteemed panel today. So I welcome all of you. May I request you, Dr. Narula, to give us a brief on the journey on cell therapy in the light of advocacy and also on an insight on pricing.
Ultimately, it all comes down to how is the patient going to get it? And when we come to cell and gene therapy, how are they going to even afford it? We see this problem, the top 5-10% will probably, they can even go abroad to get it. The next 10 to 15% may be able to get some bit of it, but the large, probably 60 to 70% are going to remain untouched unless we do something about it. So this was the problem that we started with. Now we have a CAR-T, it is approved, it is in the market, more are coming, but how are these 60-70% of the patients ever going to get it is the question that stares at us now.
So how can government policy be directed towards improving patient access for cell and gene therapy, as these are expensive and personalized?
We have been thinking about this when we started promoting research in this space of cell and gene therapy. Whatever reagents or the raw material we are getting is so expensive because it has to be imported from overseas, and they are not going to make any cost-effective products. So how India should fight for affordable gene therapy solutions? So ultimate solution is that if we want that this product to be affordable to Indian patients, I think we need to develop everything from scratch indigenously. And once we develop these reagents and these vectors indigenously, probably then we cut down the cost.
We would like to know your thoughts on the funding of cell therapy in India. And this is from an NGO perspective, so we'd like you to touch on CSR as well as non-CSR initiatives.
I believe that firstly, every life is an important life. The contribution of CAR-T cell towards saving life is indeed creditable. The implementation must go on a very large scale. That's how we look at from the NGO side when it comes to saving life. There are two components to that. Number one is the cost, and the second is the result. I believe the cost is going to reduce in time to come because there will be more players. Once we see the result, I don't see CSR funding or funding finding the place to raise money for CAR-T cell therapy will not be a problem.
And then there will be a time when this will become as routine as it is to get funding for conventional treatment. One in many would require this therapy. So how would insurance approach this? And does insurance companies have any cover such as this for out-of-the-box expenses?
One is, there is insurance cover. The Ayushman Bharat covers a very large number of people, private insurance, corporate, CGHS, ECHS, ESI, corporate funded, and a lot of Tata companies have their own schemes, a lot of PSUs have their own schemes. It is not lack of coverage, but lack of adequate coverage for people is the biggest issue. People run out of money, in the beginning course of treatment, and they end up incurring out-of-pocket expenses. So for something like CART, the request would be to engage with the industry for the specific cases which are eligible, which require that. If that is made clear, there will be less reluctance on the insurers to cover the treatment. If you look at the top reason why people exhaust sum insured or the coverage is actually cancer. Most cancer patients run out of insurance. Most of them ends up getting out of pocket. That's the reality of the situation.
But two things which you touched upon, that it has to be inpatient care and it has to be an approved therapy. That is absolutely fine. So that covers the off-label indication. If it's off-label, you will not cover it. That's absolutely acceptable. Convey to the insurers that this is legitimate treatment, it's approved treatment, but it doesn't involve inpatient. And secondly, the thing which I wanted to bring out to take this opportunity with you, would health insurance be looking at companies, be looking at schemes which help you, the insurer, in some way to cover for catastrophic health expenses? Because we know this kind of catastrophic health expenses, this would be counted as transplant or gene therapy, would be counted as a catastrophic health expense.
Actually, we need to share the outcome, whether it is success or failure, it should be brought to the public domain, that whether it is working or not. Then we don't have to repeat or give grants to different clinicians for the same work.
Thank you so much to all the panelists.